Welcome back to The Truth with Trinity, and I am your host, Trinity. And if this is your first time tuning into the podcast, welcome. Thank you for tuning in. On this podcast, I talk about issues that happen within the Black community, some food for thought, advice, resolutions, you name it. So, my topic of discussion for this episode is the racial discrimination that is practiced in the medical field amongst doctors with medicine. Okay, so I want to give you a little story. I had a troubled tooth, a tooth that was causing me problems, and um, the only place, that I could go at this particular time was a place that, you had to be there at 7 o'clock in the morning. They would pull your tooth for you. And I got my tooth pulled. They had to really go into the gums, take out some nerves. And so it was kind of like a surgical procedure, pretty much. So, it was fairly painful. I mean, extremely painful. Not fairly, but extremely. So I asked the doctor or, the dentist for some pain medication. He says, I'll write you a prescription for Tylenol. And I said, oh, I need a little bit more than Tylenol. And he said, in this demographical area, we don't give out narcotics. And so I'm looking at him crazy. So he's basically saying in a nutshell, as if he doesn't think that I comprehend, that you don't give out narcotics because you fear that black people use them to, abuse drugs and sell drugs. Okay. So I'm like, this is really messed up. So, and I described to him like, hey, this is going to cause my heart to pump even harder because I have to take, you know, 8, Tylenol a day. He said, oh, just put it with a couple of, ibuprofen and, that's going to be okay. And I'm like, this is not okay. And I've seen the practice behind the scene with doctors, how a lot of our brothers and sisters, especially the elderly, they had some procedures, pretty evasive procedures, and they only give them, non-narcotics. And I see how they treat their white patients. They'll have a little dinger, something not very, something that you would think, like you really don't need narcotics, and all they have to do is say, ouch, and they get 800 milligrams or 80 milligrams of methadone. They get 325 milligram tabs of oxycodone. They're getting, every 4 hour PRN, 20 milligrams of oxycontin, and so their argument is that there's a high chance that black people may turn the medicine over and to black underground black market, street market, to be distributed and sold, or they're saying that black people will become addicted, and it just kind of sickens me a little bit because especially with the high percentage of Caucasians in the USA, using fentanyl, abusing fentanyl, heroin, pills, pill popping, cocaine, crack, you name it. And they highlight black people as if we're the problem and we're the only problem, so they're, and I'm just like, but they don't have a problem with writing them out a prescription. And they've even got, black doctors and even, other different races of doctors doing the same thing with the same practice. So this is something I think across the board that they're systemically pushing, especially about black people, don't treat their pain. Another thing I've heard is they said that we don't feel pain the same. I think that's interesting. What do you mean we don't feel pain the same? I don't know if you've ever asked yourself that question. Like, I think that's another way of them to punish us for being black. Because what do you mean my pain and the nerve endings, I don't feel the same pain that you feel, that you may be so precious and white that your skin and your nerve endings are, so the slightest touch of pain you feel is significant. And when my if I get a leg amputation, that's when I may be able to get something, and I just think that's disgusting in our country, that they're, with that practice. And that's definitely what's going on in a lot of our hospitals and nursing homes and dentistry around the country. They're basically saying that our pain means nothing, okay, or we're some type of drug addict. We must be because we're black, right? And all the meanwhile, they're in their communities, they're strung out, and all they get is some type of what recovery. So they don't highlight that on the news, and their abuse, how they slip their family members, some of their pills, okay, and how they sell off their oxycodone. They don't talk about that, they're not going to either. So my suggestion is, if you go to a hospital, if you go to a clinic, or not even a clinic, but you've had some procedure or something where you're in pain, and you have this doctor telling you, that they're not going to prescribe you, I suggest you go to the boards, wherever your state is at. Go to the boards and report that doctor. I think more of us black people need to do that, because I think that's just uncalled for. And I think it's horrible, especially for them to say that, there's no systemic racism. I mean, here's a perfect example right here, of this type of example of some of the things and methods they use to discriminate and punish people of color for being who they are. The underhanded ways they do so, and they're not treating their white counterparts like that. They're not treating white patients like that. So, it takes each and every one of us to make a change, and hopefully one day we'll have our own hospitals. We'll have our own, doctors and things of that nature, where we won't run into that problem as much. And like I want to say too, I'm not saying that, there isn't, people that abuse, narcotics and whatnot, but they shouldn't have that practice to where they're treating every black person like that. I think that's just despicable. I don't know. How about you? How do you feel about it? So that pretty much wraps up this segment. And it's been a pleasure talking with you all. If you have any questions or suggestions, you can always reach me at thetruthwithtrinity@gmail.com. Peace and blessings.